NHS Highland British Sign Language BSL Plan 2018 to 2024. Introduction. The Scottish Government wants to make Scotland the best place in the world for BSL users to live, learn, work and visit. This means that people whose first or preferred language is BSL will be fully involved in daily and public life in Scotland and will be able to make informed choices about every part of their lives. This is the draft BSL plan for NHS Highland. It sets out how we intend to improve communication and access to services for BSL users. Draft BSL plan for NHS Highland. Each of the 6 sections set out what NHS Highland will do over the next 6 years. Some of the actions we have identified are similar to those identified by other partners. Where joint actions have been identified, we will continue working in partnership together to achieve these actions. Action Plan, Section 1. Public services, across all our services. We agree with the BSL National Plan, which says, across the Scottish public sector, information and services will be accessible to BSL users. NHS Highland Actions. By 2024, we will work with partners to promote the use of the Scottish Government's free BSL online interpreting video relay service, Contact Scotland-BSL. Promote use of Contact Scotland-BSL within our services. Train staff how and when to use Contact Scotland-BSL. Improve awareness of the service with BSL users and non-BSL users. Continue to promote the Communications Support Service. Work with partners to train staff who work with BSL users. Set up online deaf and BSL awareness training for all staff. Promote BSL classes to staff. Use existing information and gather new information about BSL users to improve support and access to our services by monitoring uptake of our BSL services, including requests for translations and interpretation services, and downloads of BSL material from our website. Analysing evidence of BSL use to inform further development of our plan. Continue to explore using technology in meeting communication support requirements. Work with BSL users, partners and the wider community to continue to develop printed guidance and information in plain English and easy-to-read formats. Promote services available among the BSL community by using social media. Support qualified BSL and English interpreters, building their skills in specialist settings like health and mental health. Work with partners to engage with BSL users and members of the deaf community to give updates on BSL plans at least once per year. Action Plan, Section 2. Family support, early learning and childcare. We agree with the BSL National Plan, which says the Getting It Right for Every Child GIRFEC approach will be fully embedded, with a deaf or deafblind child and their family offered the right information and support at the right time to engage with BSL. NHS Highland Actions. By 2024, we will make available to early years staff information about BSL, deaf culture and resources that are available in BSL and/or any easy-to-read format. Assist parents, family members and carers to get access to BSL nationally developed resources such as BookBug. Signpost parents, family members and carers to BSL courses. Action Plan Section 3. Training, Work and Social Security. We agree with the BSL National Plan, which says BSL users will be supported to develop the skills they need to become valued members of the Scottish workforce, so that they can fulfil their potential and improve Scotland's economic performance. They will be provided with support to enable them to progress in their chosen career. NHS Highland Actions. By 2024, we will work with partners who deliver skills and employment services to access information about the needs of BSL users. Work with partners who work with employer groups to access information about the needs of BSL users. Refer to the Access to Work scheme and BSL and NHS Highland information on reasonable adjustments in the workplace. Action Plan Section 4. Health, including social care, mental health and well-being. We agree with the BSL National Plan, which says BSL users will have access to the information and services they need to live active, healthy lives and to make informed choices at every stage of their lives. NHS Highland Actions. The lead agency model means that NHS Highland is commissioned to deliver adult services in Highland. Highland Council are commissioned to deliver children's services. By 2024, we will publicise information produced by NHS Health Scotland and NHS 24 supporting bowel, breast and cervical screening programmes, as well as to support childhood and seasonal flu immunisation programmes. Publicise the learning resources for health and social care staff developed by NHS Health Scotland. Work with the deaf community and partners to develop resources and information for the deaf community in formats that are easy to access and understand. Work with the deaf community and partners to develop the NHS Highland website, making this more accessible to deaf, hard of hearing or speech impaired by including signed videos providing information on what services are available, how to access services, how to make a complaint. Investigate technology-enabled systems, such as telehealth applications, to support people to self-manage long-term conditions at home. Review what mental health support is available to the deaf community. Promote signposting BSL users to out-of-hours support, for example breathing space and NHS 24. Review guidance and policies on arranging interpretation and translation services so staff can easily access the appropriate communication method for patients or service users. Aim to ensure that patients' communication and access needs are recorded at the first available opportunity, together with any relevant permission to share that information across NHS Highland. Investigate creating alternative communication methods, for example, by giving the option to text, email or use Contact Scotland-BSL when confirming appointments. Make deaf awareness training available for independent contractors, e.g. GPs, pharmacists, optometrists, dentists. Promote text service for deaf, hard of hearing or speech impaired to contact the emergency services by linking the emergency SMS website to NHS Highland website. www.emergencySMS.org.uk/registering_your_mobile_phone.phpp. Work with partners to make sure that any local work to deal with social isolation explicitly considers the needs of BSL users. Work with partners to review public protection information. Provide key messages from this in formats that are easy to access and understand. Action Plan Section 5. Transport. We agree with the BSL National Plan, which says BSL users will have safe, fair and inclusive access to public transport and the systems that support all transport use in Scotland. NHS Highland Actions. By 2024 we will promote BSL awareness training to regulated transport service providers, such as hospital taxi provision and patient transport. Encourage private transport providers contracted by NHS Highland to have access to technology to support communication with BSL users and to be deaf aware. Action Plan Section 6. Democracy. We agree with the National Plan, which says BSL users will be fully involved in democratic and public life in Scotland as active and informed citizens, as voters, as elected politicians and as board members of our public bodies. NHS Highland Actions. By 2024 we will raise awareness among our executive and non-executive board members about Contact Scotland-BSL. Work with partners to develop and promote accessible guidelines for activities and events.